Hi, it's Jenny B, NSWC, back with our time series on infection. And today I want to talk about the Levine technique for swabbing. So this is how we actually are going to take a culture based on our best practice for actually, extracting some of the fluid out of the wound. So days gone by, we've always done this little wipey swipey, or done a Z technique to try to cover the whole surface of the wound to try to capture what bacteria are in it. And even days gone by before that, someone would open an abscess and they of course want to culture that abscess, and sometimes the microbes and the bacteria that's actually in the fluid isn't actually indicative of what's in the wound. So most NSWCs, we use a technique called Levine technique. So it's where we're actually going to irrigate out this wound first really well and nice and clean. I just got my butt model so I don't have to show the irrigation part, but we're going to clean it first prior to actually taking the swab. And then you're actually going to take a swab stick, and after it's been cleaned, and we're not actually going to point to places we're not going to go. We're not going to take it out of the black eschar that's actually got a whole bunch of microbes in it because it's devitalized dead tissue. We're not going to take it out of the slough because, again, that also has devitalized tissue and lots of microbes that are probably not indicative of what's in the wound. We're not going to swab over the area of bone. We're going to try to stay out of the undermined areas as well. Up here, there's a nice big lip in there, but we're not going to swab in there. So again, before we touch any of it, we're going to actually choose a spot that's red, healthier looking, because sometimes it's pale, granulation tissue, and we're going to actually push on it. This actually should hurt a little bit. So for the most part, you can kind of warn the patient that it's going to, or sometimes you take them by surprise and then say, oops, sorry it hurt so much, but now we're going to have a really good swab. So again, if you take it straight on and you're actually going to push on the wound to actually try to express some fluid that's coming out of there. This is really what the Levine technique is. Now, anybody that works in the lab, they'll also tell you they do kind of want you to get some of it on the sides of the swab, because when they put it on the petri dish, they scrape it across the dish, and if you've only got it on the tip, then they might not, it might come back with just commensal flora and you won't actually know what's in it. So if you can also, once you're going straight in, you can push it a little bit on the side too, and even a little roll, just a little, or move the swab. Then you'll get some on the sides. And again, that's a quick, easy Levine technique for swabbing. Make sure you clean it first, not to go into any of the devitalized tissue. And again, push. It should hurt a little bit. Prepare your patient for the most part that it's going to. Sometimes they don't feel it depending on where the wound is. But again, it's really those 3 steps, and then you've got a really good swab. Once you've come out, you're going to pull your cap off your swab, put it in your medium, and you're good to go. Now, if the wound is super dry, the other little tip is they used to actually teach to take some of the medium out of the bottom of the swab and apply it. For the most part, you're still going to want to try to get that fluid expressed out. That's going to give us the best quality swab for the wound. And then we're giving them the targeted, the most correct antibiotics that they need to actually heal it. Great. So that's the Levine technique in a nutshell. And hope to catch you now in the next video.